Her name is Dhora Tinta. So she's the mother of Oliveira's a daughter. Since she was born, they did not know that she was a sickle cell disease bird. So they just know about it recently through February last year. So once there was a worry about that diagnosis, she knows about Dr. Gaurav Kharya through one of their friends who is also a doctor in Uganda. So they start making some process of coming here for giving her a better life.
Oliveira's came to us with a disease, with a diagnosis which is very common in that part of the world, called as sickle cell disease. And some of you might be aware that it's a disease which comes with a lot of suffering. The only curative treatment for sickle cell disease is bone marrow transplant. So that is why Oliveira's came to us for a curative solution in the form of bone marrow transplant.
So when we met Dr. Gaurav Kharya, we really appreciate his way of working. He's a good doctor, he's a good pediatric also. From the beginning, he has already explained us how the planning will be, which cure she has to take, which product she has to take. He has already explained us from the beginning of all this process.
When she came to us, we evaluated her thoroughly, and fortunately we found a HLA identical donor in one of her siblings. Subsequently, she's slightly older, and as the patient gets older, the challenges of transplant, especially for sickle cell disease, they increases. So we prepared her for almost 2 months prior to transplant, and then we took her up for transplant.
The transplant was successfully made. It was very, very successful. So she's fine. She's not having any crises. She's not having pain on the leg or anywhere. So she's ill. She's very fine. She's going well.
Transplant course pretty okay, uneventful, and so was the post-transplant recovery period till day 100. And she has completed her day 100, and she's looking forward to going back to her country. And she's free of all the complications related to sickle cell disease. So we wish her all the very best for her future endeavors.
So Dr. Kharya's staff they are very, very good. Himself is a very experienced doctor. So we have seen how he made the BMT, how he was conscious, how he was very aware about the process. So even his staff also, they are very good staff. Despite of every problem, every issue that we could have as human being, we are grateful to him. He's very good doctor, and even Apollo staff, they are very good staff.
So for all the viewers, I'd like to conclude with a message that sickle cell disease comes with a lot of suffering, but it's not a death sentence. It can very well be cured by offering a bone marrow transplant. So please, if your kid or someone known to you is suffering from sickle cell disease, please get in touch with a physician and consider a bone marrow transplant as a curative option. Thank you.